How do hearing health professionals diagnose sound sensitivity? Have you ever wondered how hearing health professionals figure out if someone has sound sensitivity? This condition, often called hyperacusis, involves a decreased tolerance to everyday sounds. The diagnosis process is quite detailed and involves several steps to ensure accurate results. First, the audiologist or hearing specialist conducts a thorough clinical interview. During this conversation, they ask the patient about their symptoms. They want to know what types of sounds cause discomfort, how intense the sensitivity is, and if there are any other conditions present, like tinnitus or hearing loss. This information helps distinguish sound sensitivity from other auditory issues. Next, the professional performs a comprehensive audiological evaluation. This usually starts with pure tone audiometry. In this test, the patient listens to a series of tones at different frequencies and indicates the faintest sounds they can hear. While this test mainly identifies hearing loss, it also provides important baseline data on hearing sensitivity, which is crucial for diagnosing sound sensitivity. To specifically measure how much sound is tolerable, the clinician conducts loudness discomfort level testing. This is also known as uncomfortable loudness level testing. In this test, sounds are played at gradually increasing volumes until the patient reports discomfort. If the levels at which the patient feels discomfort are lower than normal, it indicates increased sound sensitivity. Additional assessments might include speech and noise tests. These tests help evaluate how well the patient processes sounds in noisy environments. Questionnaires may also be used to quantify how sound sensitivity affects daily life. Sometimes, referrals to other specialists are necessary to rule out any underlying neurological or psychological issues. In summary, diagnosing sound sensitivity is a comprehensive process. It combines subjective reports from the patient with objective audiological measures. This thorough approach ensures accurate identification and helps guide suitable management strategies. These strategies may include sound therapy, counseling, or hearing protection. Hearing health professionals diagnose sound sensitivity by taking a detailed history of symptoms, conducting pure tone audiometry, performing loudness discomfort level testing, using speech and noise tests, and considering multidisciplinary evaluations when needed. This careful evaluation aligns with current clinical standards and aims to improve the quality of life for those experiencing sound sensitivity.